The word midwife itself means with woman. So midwives are people who feel called to really invest themselves in women and in families and take care of them. And midwives provide pretty much a full scope of care. We do prenatal care, we do intrapartum care, which is the labor and delivery, and we do postpartum care. And then we provide well woman care and a little bit of primary care in there. So we can do a lot of things. A certified nurse midwife has a bigger scope of practice than a direct entry midwife. And say we have a lady with a urinary tract infection, we can diagnose that and prescribe and make sure that they're okay ourselves, whereas a direct entry midwife would have to send her patient into a doctor or maybe in to see one of us to get that care. With a certified nurse midwife, we have not only access to our doctors, but when we work within a system like CHRISTUS, then we have access to all the other physicians and providers in that system. We have access to a large group of people who can help take care of someone. First of all, midwives don't rush their visits. We take the time to really listen, ask questions ourselves, not just them ask questions, but it's a two-way thing because you're building a relationship. Good outcomes are based on good information and also trust. And so you're building a trust relationship with them. We want to provide them with education so they can make good choices for themselves. We offer them things in labor, like they can do more natural things. They can get up and move around. The dad can help deliver the baby if he wants to. Their family can be present there. They can have a peaceful environment, nice and quiet, and we're a lot less interventive. Like we don't use the typical stirrups and all that stuff during delivery. We let them get into the positions that they want to for labor. So there's a lot more choice, and it's a lot more comfortable most of the time because they're able to listen to their bodies and let their bodies lead them in birthing their babies. After a lady has a baby, we also follow her for the first 6 weeks. She comes to the clinic for postpartum visits, and one of the things that is very important to all of us is that her mental health is stable too, because it's very common in postpartum for those hormones to be just going crazy. And so we're all trained and we're all able to screen and help them with postpartum depression or any kind of things that might be going on like that as well. It's mental health is just as important as your physical health. I think women choose midwives because they want a more natural route for birth and for their care overall. And I think that they really enjoy the relationship of it. I have people I've delivered 10 babies for, they're like part of my family. And when I see them, it just makes me so happy to see all the things that have happened in their family and how their family's grown. The most important thing about a midwife is that it's about relationship. She invests herself in her patients. She loves them like they're her own family. And it's about continuity of care, seeing them from the beginning all the way to the end.